A little piece for mom. A lot of pieces for the family. The Zaxby's Family Pack. Your choice of 20 chicken fingers or 30 boneless wings, plus fries and Texas toast. With Zax sauce or spicy Zax sauce. Only at Zaxby's.
TVFCU, a place for all of us.
You know, sometimes we feel a bit like social event planners around here on 3+U because it's so fun to have a chance to highlight the many organizations that are doing fundraisers and that type of thing, especially in the springtime. So Adult and Teen Challenge is inviting you out to their event, their fundraiser event this year called All Things New. Do I have that right?
You got it right.
David McNabb is sitting here giving me the thumbs up. So
yes.
Good to see you.
Good to see you.
You and I were chatting a little bit about how there's nothing wrong with going to a banquet event, but
right.
Those days seem to be a little bit gone.
They are.
People want to be out, but they want to be participating
yes.
in something.
And this, Julie, this event, we want it because we've done the banquets for years and years and years, and they're fun. We have a good time, but we want to do something that's out of the box. And we've been telling folks that this event is so far out of our box we can't even see the box anymore, because we're going to be meeting this year. We'll be at the First Horizon Pavilion downtown on May 14th at 1 o'clock. Now this event is going to go on all evening, starting at 1 o'clock in the afternoon. On up till when Big Daddy Weave is our featured guest. They're going to be taking the stage later on the evening. But we're going to have worship bands playing all day long. Food trucks are going to be there providing their food for us all day long. We're going to have all kinds of family fun, family-friendly events. We've got multiple bounce houses are going to be there.
Fun.
We've got one church, one of our participating churches is going to be supplying a mobile arcade. So we're going to have all kinds of fun stuff to do. We're going to have a cornhole tournament in the afternoon featuring some newly appointed State Representative Greg Martin, who is our chairman of the board at Adult and Teen Challenge, is going to be my partner. And so we have a team. I think Matt Hollander has signed on. He's going to be playing as well. So we're going to have a lot of fun in the afternoon with just family fun stuff, testimonies of what we do at Adult and Teen Challenge rolling all day long. It's a way to get some folks that may not have come to a banquet to be a part of a family-friendly event to see what it is the work that we do.
Well, and you know, I think that the family-friendly nature of it, I think, is very smart because we certainly came together as families these last 2 years with COVID, and I think people have realized that you don't want to always give that up on the one Friday night that you have to get a babysitter and say see ya. Exactly,
and that's the thing. You know, when it comes to addiction, whatever the addiction may be, families involved with it, whether they want to be or not. And so it's like this is an opportunity to come and hear about a ministry that's providing freedom from addiction, but at the same time doing it in a very informal way, where it's not the staid kind of I want to preach to you about what we do, compel you to give an offering, so forth, because your money is always accepted. But our focus is to let folks know what it is that we do and expose them to the community.
Well, and let's talk about that because, you know, here I glossed over it and said the good thing from the last couple of years has been this family closeness, but for an awful lot of people, these last 2 years have been anything but helpful, and addictions did go up.
They did.
Y'all have had a proven success in helping people beat those.
Our recidivism rate is actually about 1/4 of the national average, because what we teach is disease requires a treatment, but bondage needs to have a deliverer. And what we talk about is, you know, when it comes to the addiction aspect of it, if somebody has been cordoned off or quarantined for these last couple of years, the very worst of what they're all about comes to be they don't have the fellowship, they don't have the interaction with folks, and that depression that any of us could be prone to is just magnified for someone who struggles with some kind of a substance abuse.
Do you almost anticipate that when you're doing this event on the 14th, since it is all day long, that there might be some people who come who are on the cusp?
We hope so.
And they come to sort of see what you're all about.
Right. Because of the nature of the event, it's an outdoor event there in the pavilion. But if somebody happens to just go by and hear a testimony or hear some of the music or whatever, you know, it's going to be a very community-friendly event. Now, for the concert, we have bands and we have tickets for the concert. But during the events of the morning, I mean, you're free to come and talk to any of us.
Okay, so let's clarify then. It begins at 1.
Right.
are you saying that when you come at one, sort of depending on what part of the venue you have access to,
Right.
you pay or you don't pay?
Right. During the afternoon events, up until the concert, that's actually the ticketed part of what we're doing. To come to register for the cornhole tournament, there's a fee to register to participate.
I see.
But if you want to come to be a part of and buy some stuff off the food truck, or if you want to
I
come and
see.
play in the stuff like that, the different things we got going on, yeah, that's our service to the community, that part of the event.
And back to the family side of it, I know that the people who are in your care at Adult and Teen Challenge have chosen to be there.
Right.
But a minute left. When they're through, very often the first thing that they do is reunite with their family that loves them.
Exactly. That's what we want. And we want those families to say, you know, this is the kid, this is the spouse, this is the mom and dad that we lost a long time ago, and then we have them back. That's the ultimate blessing for us. But we also know when they're finished with us, they stay connected to us because we want to be their accountability even beyond the program. No, once you're one of ours, we want you to maintain that relationship because you know, we're part of family, and that's the way we believe it with the gospel.
So for May 14th, do they
Yes.
get their tickets for all of it now, or can they get it that day when they show up?
Both.
Okay.
We'd prefer if they would. It always helps us with planning and seating and so forth. If they would go ahead to our website and register online and get their armbands and everything, that will work out great.
Okay, it's tcmidsouth.org. The fun begins at 1, runs until 9 on May 14th. And if you happen to have a cornhole board at your house, start practicing now.
I would suggest it.
Maybe you could beat David and his team.
We play to win.
Thank you so much. We're back after this.
Watch Local 3 News for complete local election coverage
Local 3 is explaining the issues
and connecting you to the candidates.
so you can make your choice on air and on local3news.com.
Brought to you by Warren and Griffin, your local 5-star law firm.
Every morning, we put on our boots and go to work. The day starts early and often ends late. It's the Tennessee way. Some lawyers call that work, but to us, it's a passion for helping injured victims. But ultimately, it's not about the boots or even our success. It's about the 20,000 clients that we have represented over the years, and the next 20,000 we look forward to representing in the future.
Wettermark Keith, the name you know and trust.
This CHA Spotlight features the National Medal of Honor Heritage Center.
Did you know that Chattanooga is the birthplace of the Medal of Honor? This center tells the stories of ordinary individuals who expressed extraordinary valor. With 19,000 square feet, this center is a historic experience for everyone.
This is a CHA Spotlight only at visitchattanooga.com.
Gentlemen, I have a proposition. It's high time we change the name of this mountain to Mount Cashmore. Mount Cashmore? On whose account shall we grant this change, Mr. Roosevelt? On account of the fact I'm about to win millions in Lotto America. Millions? That's enough for 3, maybe 4 score. Abe, just say it in years. Gentlemen decorum. Now, Teddy, can we find this Lotto America in the great state of Tennessee? Yes, sir. Then let's march.
With Lotto America, you might just end up meeting a few presidents. The Tennessee Lottery, game-changing fun.
Register your child to escape to nature this summer. Reflection Writing's Outdoor Summer Day Camp is the best in Chattanooga for ages 5 through 14. Immersive, educational fun to keep your camper happy and active. Scan the QR code now to sign up.
I realize that for a lot of you watching the show this morning, it can be a pretty simple thing if you wake up and you've either got to make a doctor's appointment that's scheduled, or you're just not feeling very good and you want to get in with your primary care doctor. It's no big deal to pick up the phone, make that call, and your appointment is set. But for an awful lot of people, that access to health care that we talk about is not really always that simple. And this month we focus on minority health. This morning we're referencing as Black and Brown Health Awareness Month. So I'm very happy to have Ladarius Price, who is sitting next to me. Paulo Hudson is on the other side of our studio this morning, and together they are here representing the outreach that's done each and every day at CEMPA Community Care. So nice to see you.
Thank you.
We've kind of had a lovely conversation, I think, this morning already, Ladarius, because you and Paulo were kind enough to talk to me a little bit and break it down. When we hear this kind of generic phrase of wanting to raise awareness about the lack of access to health care,
Yes.
what that really means in the Black and Brown communities.
Yes.
What it really means is that y'all at CEMPA aren't taking anything for granted, and rather than trying to educate them and get people to go to the doctor, you're bringing it right into these communities. Is that right?
Yes. Yeah, it's definitely a game changer, and it's something that it's a staple in our foundation at CEMPA, that we remove a lot of the barriers that exist in Black and brown communities. It's a reality for a lot of them. So at CEMPA, we've been very strategic at making sure that we come up, and I don't like to use the term programs because programs come in and they go away, but it's a lot of our makeup and who we are to really go into the community and not only provide health care, but provide excellent health care for people in our communities.
So Paula, you were sharing just a few statistics 'cause on the Latino side of things. You were sharing with me something simple like, is it 80% you said of Latinos 20 and over are pre-diabetic?
And don't know it. That's the thing, is when we're creating access or creating awareness, a lot of times we want our communities themselves to know what they're facing and ways that they can really take control of their health. And CEMPA has always had a mission to serve the underserved and vulnerable populations going back 35 years. To the 80s, what we were fighting at that time, similar to COVID, that was so unprecedented and uncertain, such as HIV back then. And so creating that awareness and creating programs or having educational resources that can take someone from not knowing their status of health to educating them to getting control of their health is what CEMPA is really here to do.
Well, and you know, for anybody, at least for me, repetition is the key to success. So by being able, Ladarius, to go into these communities, whether it is through, I don't know, all the different things that you do, if you're just passing out literature, if you're actually doing active programs with people, what are some of the things that you are doing and engaging?
So we do a number of things when we talk about like our CEMPA Neighborhood Workout Jam, where we go into different communities and we provide for free a workout with a DJ, a very active fitness instructor that makes exercising a lot of fun. And we also just on yesterday we did one and we provided a healthy meal for them as well, so they can understand it's not just about exercising, but it's also about meal portion, it's also about eating the right thing, and ultimately doing education in those settings as well, where we educate them about different things that are going on with them, so they can take full ownership over their health.
Right. Do you ever have it where there are actual medical professionals going into these neighborhoods too?
Most definitely. We've gone out to churches and we've gone out into many of our communities with our mobile unit to provide just your basic screenings. And through that, once you find out what you may be dealing with, you're able to be linked into care. So it's not just about being screened, it's also taking the information that you get from your screenings and being linked into care so you can fully understand and address what's going on with you. So we want to shift to preventative care. Yeah.
Okay, so Paulo, on your side too, you were saying that there is a Spanish side of this, right? That there is, if you don't speak English, you can get your information in Spanish.
Absolutely. At CEMPA, inclusivity is at our core. We want to make sure that regardless of language, of origin, that you have access to the healthcare that you need. And so when you come to CEMPA, you're able to receive educational materials, keeping in mind that the Latino community has such a spectrum when it comes to language capabilities and health literacy and access points. So at CEMPA, we make sure that regardless of language or origin, you're able to talk to someone, you're able to read and write in your own language.
And I only have about a minute left, but I guess that the totality of this then becomes that for all healthcare providers in the viewing area, this certainly benefits them, because the healthier our community can be, the better their profession can be, right?
Most definitely. And I mean, ultimately, going to what you just said, it's not about CEMPA, it's not about this organization, that it's about us coming together. It's about collaboration over competition. We are doing this for the greater good of our community, and when we put them at the forefront and we say that our community, the health of our community is our priority, then you remove all of those silos and you come together in unison to make sure we have a healthier Chattanooga.
Well, I learned something because I've been talking to y'all for a long time, different members on the board there at CEMPA, and I did not know that you had this outreach. So kudos to you. I think that's fantastic.
Thank you.
Thank you both so very much. If you want to get in touch with them at CEMPA, the website is CEMPA.org. The phone number is 265-2273. So if you're a church and you would like to maybe have them come to you and do some of these programs, if you are a teacher and you can think of a group of people that might benefit from this and you too didn't realize the outreach, they would love to hear from you. Thank you.
At Chattanooga Allergy Clinic,